for some health news that we've been talking about for the better part of the week. This month, the American Medical Association released a new guideline saying that body mass index, or BMI, should not be used as the sole indicator of whether or not someone is healthy.
Yes, so BMI has been used as the standard to determine obesity since the 80s, but it has long been criticized for not taking into account a person's body composition. Thank you.
Joining us this morning is Dr. Reshmi Srinath, an endocrinologist and the director of Mount Sinai's Weight and Metabolism Management Program. Thank you so much for joining us this morning.
Hi. Good morning. Thank you so much.
I would like you to begin with your anecdote of when you were in college.
Gladly. I was going to the pool. I'll never forget it because I was so scarred by this, with a friend who was, he's now a nurse, but he was studying to be a nurse. And I said, you know, Pete, apparently, according to this chart that I just saw, I'm obese. And he was like, what are you looking at? He was like, the BMI chart. I said, no, you're not obese. I mean, yes, but no.
Yes, but no.
He's like, take that with a grain of salt.
Yeah.
But that was a jarring and scarring experience as a 19, 20-year-old college girl.
Who
was an athlete.
That's right.
Division I. And, you know, just very conscious of my physical
As though we don't have enough to worry
exactly.
about or take into consideration. So talk to us, doctor, about the significance of these new findings and these new guidelines.
Yeah, so I think it's really important and really timely.
Yes.
We know, there's growing awareness of our weight, and I will say patients, everyone, we're more savvy.
Yeah.
There's a lot in the media, there's a lot of awareness. So the recent guidelines, or policy I should say, really just shed light on the fact that we need to de-emphasize this word body mass index, or BMI.
And for the uninitiated, what is the ratio? What exactly is our body mass index?
So it's comparing your height by your weight. And it's a measure, it's very easy to capture. That's part of the reason why it's been used for so long. You can take it in the office. You really just need very minimal markers. But what it basically tells you is comparing that, how does a person compare in terms of their weight and how considerably we'll consider overweight, over obese they are. So having a BMI over 25 is considered overweight based on current guidelines, and have a BMI over 30 is considered to have obesity. What we know is that these determinations were based on populations that were Caucasian, non-Hispanic, and now, these really can't be compared. Everyone has unique body types, and it's really not something that should be used to compare every single individual against as a parameter.
Exactly, and it seems so obvious when you're saying it, but is this necessarily new information, or is this kind of the thing that doctors and medical professionals have always kind of known, and they were just like, what is?
Did they just have this epiphany?
Yeah. What has your experience been with this?
It's been moving this direction for a long time. So I would say maybe over a decade, we started saying, okay, the BMI is not a perfect marker.
Great.
So we have the American Association of Clinical Endocrinology, who published guidelines in 2016, which I'm actually part of a committee now. We're updating them, and
Good
it's
for
really
you.
exciting.
Thank you for your service.
But the idea is that yes, we need to de-emphasize BMI. We need to focus on other markers of weight and really assess a person as an individual, holistic approach in terms of all the other things that are going on.
So if not BMI, what are the markers? What should the standard be to determine someone's healthy weight?
So there are other things that we can measure in the office. We can measure your waist circumference. So just using
your
a simple
waist
taste measure. And it's important because many times when people lose weight, they notice, oh, I'm not losing pounds, but I feel it in my clothes. My pants are a little bit looser, my shirt's a little bit looser. So they notice that immediately. So that's one thing. There's also markers for body composition. We don't do it, we don't cover it by insurance, but you can go to many gyms, facilities, and get body composition. That's something that can be helpful. The other point is just basic blood work, assessing patients' risk of diabetes.
When in doubt.
Cholesterol, heart disease, these are the things we want to prevent. So the focus is really, let's shift away from BMI and move towards more the complications, what's going on with the person and how we can help them.
Right.
I like the broader stroke look, and because then you're saying this and it makes me think, Marisol and myself, we both like to lift weights.
Right.
It's a regular part of our exercise regimen, and I know that muscle weighs more than fat.
Exactly.
So that's why, does that kind of go hand in hand with looking at the body composition? Because, maybe I'm 5'7", and I weigh 160 pounds,
But you are lean muscle.
But it's more muscle than,
Yeah.
you know. So talk to us about that kind
So
of
definitely
correlation.
no, it underestimates fat. So BMI underestimates fat, and definitely you're right, fat weighs more than muscle. So I'd rather prefer you have more muscle mass and are healthier metabolically than have a lower BMI and not be healthy.
You mentioned earlier that the AMA, the governing body, was not taking into consideration the anthropology of all this,
Yeah.
right? Peoples coming from different regions of the world. Why do you suppose that was, and how do we advance that to accurately reflect the different people that just make up the globe?
Yeah.
I think first it's awareness. So these measurements were developed over 30, 40 years
Yeah.
ago. So it's awareness, it's understanding that these are not perfect. I think everyone's more aware now. So people have to actually come to me and say, hey, I want to be a normal BMI. And it's actually saying back to them, well, wait, let's take a step back. Let's take a sense of where you felt healthy. Let's take a sense of your body type and sort of say, maybe these aren't realistic expectations. Let's get a better sense because, again, BMI is not perfect.
Dr. Srinath, thank you so much for having this conversation with us and helping to change the dialogue and the narrative
That's right,
when it
definitely.
comes to this because
I appreciate
it's very
being here.
important.